Hey, I will be opening the subcommittee, the Criminal Justice Subcommittee work session on House Bill 470FN relative to fentanyl test strips and other drug checking equipment. If you could please rise and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice. Okay, thank you. Just going to take a brief 5-minute recess. I will now reopen Criminal Justice Subcommittee work session on House Bill 470 relative to fentanyl test strips and other drug checking equipment. I'd like to start off by thanking everyone who's involved, Representative Muse, I know Representative Newell definitely put a lot into this. Again, as I testified or spoke the last time about this, I think it's a really good bill to have. However, there's so many back doors where the nefarious, the drug dealers and traffickers are going to use this as a defense. Any defense attorney is going to look at this bill as is and use it for their behalf. I sat through for a week when I got the amendment and really looked at it thoroughly. And the only way that I feel that this can go through is to completely gut the bill and change the wordage to prevent those unsavory characters from using this as their defense. We do have the fentanyl and xylazine bill that did go through, which is great. I just think, again, as is, that there's too many loopholes where at its face, that wasn't the intent of the bill, but I think it is going to be used for those nefarious characters. We can vote on it today. Obviously, we'll hear some more testimony. It's probably going to go 3-3, and we'll see how it goes. Again, I just really wish that this could be chopped so much that we don't allow them to use the back door. And this isn't a back door. This is back doors, multiple doors where they're going to sneak in. Representative Selig.
Thank you. I know that last time we struggled with whether or not to meet, and I'm glad that we were able to have the conversation then. And, you know, I didn't come in today with my mind made up. I came in today knowing we needed to have the conversation, and I hope that we can all be here with that same energy. But I also was thinking as I drove over here about the title of our committee, which is criminal justice, which is how we mostly refer to ourselves. But there's a significant other part of it, which is and public safety. And so I'm hopeful that we can be looking at this bill not just through the eyes of criminal justice, but really also, and probably more so with the eyes of public safety as we move forward. And I know that Representative Muse has been working on some amendments to try to help make the language and the structure of the bill more palatable and narrow the focus so that it's not used by, as the term you used, I think, was nefarious characters, which makes me think of the Minions, but you know, sorry, I'm a parent. But I just would say, as we move through today, I really hope we can be looking at all of this through the focus of public safety. And again, as I said last time, the goal is one more day so that hopefully people can recognize that that's the day they should try to get into recovery.
Thank you. Representative Reed.
Thank you, Mr. Chairman. So on our bail last committee meeting for bail reform, we had wonderful testimony from this community member out of Manchester, Jesus Lopez. And he is a former drug dealer. He came from the Bronx, settled in Manchester, and he said that and this plays into public safety. He said that New Hampshire people come to New Hampshire because our laws are so lax, and that he could in the past get so much more money for his drugs in New Hampshire that we actually attract drugs and dealers. After he, gave his really wonderful, moving testimony, I asked him, I says, do substance misuse sufferers actually test their drugs for fentanyl? He said no. I said, should we legalize nominal amounts of illicit substances for testing? He said no. He says because it enables addicts. And I have to respect him because he's lived this. This was his life. He spent 11 years in prison. Part of it was a federal prison for being a drug dealer. Thank you. So I have to listen to him, and his goal now is to keep people safe. And if he doesn't feel this is a good idea, I do not feel that I can usurp his testimony and say that I can support this. Thank you.
Thank you, Representative Muse.
I think one of the things that we try to avoid on this committee is legislating by anecdote. Personal stories are powerful in the context of the bail bills, in the context of this bill. Um, we've heard some pretty powerful stories along the way. One of the things that we also have are some pretty powerful updated statistics. So in Nashua and Manchester, so far this year, American Medical Response, which is an ambulance service, has responded to over 700 overdoses. And unfortunately, quite a few of those overdoses have been fatal overdoses. And when asked to comment on, why we're still seeing these high fatal overdose rates, the regional director of American Medical Response said, people who are using illicit substances have no idea what they are using contains synthetic fentanyl or how potent synthetic fentanyl in the product is. The people who use these drugs are not necessarily all drug dealers from the Bronx. A lot of them are high school kids, they're college kids, they're our kids, they're our parents, they're our husbands, our wives, our daughters, our sons. And I think one of the things that we need to keep in mind is that the main objective of this bill and also some of the proposals that we've had to amend it, what we're really trying to do here are save lives. I mean, that's basically what it comes down to. We not only have an overdose problem in New Hampshire, we have an overdose fatality problem. And there are things that we can do from a law enforcement perspective that can help. Catching more drug dealers and putting them in jail is a good thing. But I think one of the things that we've learned over the past few years is that we can do that. We can support our police in their efforts to do that. And we should support our police in their efforts to do that. But I think the other thing that we need to look at is, and we need to recognize, is that this issue is not just a criminal justice problem, it's also a public health problem. And as a public health problem, one of the things that you do is you look at issues like this through a slightly different lens. In criminal justice, we like to talk about being able to prevent things and changing the law, to prevent people, or disincentivize people from doing certain things. In the public health world, one of the things that we talk about is trying to actually reduce the risk of bad things happening. I think we realize that nothing we do on this committee, no law we can pass, is going to ensure that people don't continue to overdose on fentanyl and that some people won't continue to die from fentanyl. But there are steps that we can take by changing our law that can help ensure that fewer people are dying. And again, we're not just talking about drug leaders from the Bronx or people from Lowell and Lawrence. The people who are dying are people's sons, daughters, husbands, wives. And this is just something we have the power to do, that we have the power to act on. We have a good bill in front of us that would make it possible for more people to be able to check their drugs to make sure that they don't contain illicit substances or contain substances that they didn't even know they were taking, which is one of the biggest problems with fentanyl. And I think that while we took an important step in terms of legalizing fentanyl and xylazine test strips, if we really want to achieve results in this area, and if we're really serious about reducing the death rate, then this is the kind of bill that we need to pass. And I would like to try to find a way we can come together on it. Thank you.
Thank you. Excuse me, just real briefly, and then Representative Prue. Looking through the law enforcement lens, which I was a state police, state trooper for 2 decades, these bills criminals do not care about. Otherwise, they wouldn't be committing crimes. And I do appreciate, yes, we do need to reduce these deaths, but the criminals do not care. And what this is doing is, while we're now helping the person who's addicted to test their drugs. We are now giving the criminal the back door to use a defense to get them back onto the streets to continue to sell drugs. That's why we really need to chop this down if it goes forward. And again, I do like it at its face, but I'm looking in my lens as law enforcement, and they will use this for their defense, and they won't be locked up. They'll get back onto the streets and continue while more of those who are addicted are going to continue to be addicted. Representative Prue?
So I work on the street as an EMT. I can't tell you how much Narcan I've given, but I'm pretty sure none of these people take the time to test their drugs. They get them, they take them, and off they go. And that's, I think, has to do with them overdosing, is that they don't even measure correctly or understand that if they went from their old dealer to a new dealer, it's probably changed a little bit and they should be cautious. They don't care. They're just going to take the same amount to get that high, and that's all they care about. They're not going to take out their little test kit and say, oh, I got to test this to see if there's fentanyl in there. And frankly, I think they might even like the fentanyl because it gives them a better high. And they're, playing craps with that. Is it going to get me just higher, or is it going to push me over? And hopefully if I go over, my friend has Narcan in his pocket and they'll take care of me. But I don't see this as the answer the way it's written.
Thank you, Representative Newell.
So I'm looking at a 50-state survey for the legality of drug checking equipment in the United States. And while I can understand that there might be, that there could be some remote possibility of someone using it as a defense, I'm really curious what this information doesn't tell me, and I'd love to know, is if when they passed legalization of drug checking equipment, defenses using this law were used, because I feel like we'd hear about that. I think that would be something that, that people would be up in arms about, and rightly so if that were the case. And I just keep coming back to the very small amount that it is when we say nominal, when we say nominal, and we're trying to make sure that we restrict that as much as possible. I think, the reason we're doing that is so that we can allow for the benefit in this one way and protect against the potential for harm in another way. So I think that's really what we've been trying to do here, is weigh the benefits and the potential for the potential risks. But also, just at the end of the day, I feel like we have so much information to back up how this is important and how this can be helpful, and so little evidence to the contrary, like that the risks that people are using it in cases. And I think, we as a body have a responsibility to look at the evidence as it exists, and not necessarily make a decision based on, the worst possible, well, maybe somebody could do this or whatever, especially if we're not seeing that happen, so I can understand the concern about it, but sometimes concerns don't really pan out. And I feel like what we've been trying to do is trying to make it as specific as possible so that we reduce that risk while maintaining the potential benefits for it. So.
Thank you, Representative Reed, then Representative Muse, then Representative Selig.
Thank you, Mr. Chairman. Substance abuse misuse disorders, progressively fatal, very resistant to treatment. Generally, people who are struggle with opioids, many of them don't survive their addiction. By making it, for a lack of a better word, easier, I think that a tough disease needs to be dealt with on a serious level. I would like to see statistics showing that how many lives are saved due to testing. I would like to see statistics, and I'm sure there are none out there that could support lives saved from having available drug testing equipment. That would make me more comfortable with a decision. Thank you.
So back in February and March, when we were considering this bill, we actually did hear testimony from law enforcement, from state police, also from the Chiefs of Police Association, and they expressed some of the concerns that Representative Tenzar expressed as well. So in response to that, one of the things that we did was we did draft an amendment that we were going to talk about during our executive session, but we decided, given the fact that the fentanyl test strips bill had passed, we decided to retain this bill. So we never were able to propose the amendment. One of the things that I've handed out to members of the committee is essentially a marked up copy of the original bill with the amendment text included in there. And the amendment text addresses things like some of the concerns around packaging and repackaging, and making it clear that these things that, you know, we're talking about it in the context of drug checking only, not in terms of manufacturing or distributing these chemicals. We added language defining a nominal amount because, frankly, you have to have some level of these illicit drugs available to actually be able to do any type of a test. I think one of the other things that we also need to pay attention to are some things that have sort of flown under the radar a little bit. So one of the things that's been going on in this field is there have been some companies that have been developing potentially more effective versions of naloxone. And because our Controlled Drug Act only specifically names naloxone, there could be a potential issue with being able to use some of these new and improved agents to actually help people who are, who actually do overdose. So there are some things like that that are baked into the amendment as well. We also would have to do things like change the effective date, which I think is now June 2023. So we can't go back in time. So we need to go forward in time. One thing that I I would just suggest too, we have Lauren McGinley here, who testified originally in favor of the bill, who can answer just specific questions that we may have around the amendment. Actually, a lot of the suggestions for the amendment text came from Ms. McGinley and from Carrie Nolte, who also works in the harm reduction field here in New Hampshire. So it'd be great to hear from them at whatever point the chair feels that it would be appropriate to do that.
Thank you. Representative Selig.
Thank you. I definitely agree with Representative Muse. And I remember last week when we were leaving, my recollection is that you had talked about we had been working from an amendment that Representative Muse had prepared last year that we hadn't used, 2023-0515, where we were working on some of the language of that. My understanding was that you were considering doing some additional work to that to bring forward an amendment for all of us to talk about this week. And I just wasn't sure if that had happened, or if you'd made a different decision, and just if I could understand where we got from the end of our last meeting, where there was going to be a potential amendment that we could work through, to we don't want to move forward at all. And I'm just trying to make the two things make sense in my head.
Thank you. Yes, we had that kind of quasi agreement to look at this, to change the language. But as I sat down and read the full bill, and this was literally a week of me like going back to it, I was like a madman, if you will, trying to figure out how can we make this work based upon what Representative Newman had kind of suggested to the committee. And the more I looked at it, the more I thought that the back doors were opening more and more and more. And I wanted us to talk further about it, because I would, and in my law enforcement background and through my degrees with criminal justice and law, looking at this, it would have had to been completely slashed. So I did kind of make that almost 180-ish. So I hope that answers your question. I'll call Ms. Lauren McGinley.
Am I on? Okay. Hi. Good morning, everyone. So I'm Lauren McGinley. I'm the executive director of the New Hampshire Harm Reduction Coalition. As Representative Muse mentioned, I work very closely with Dr. Nolte out of UNH, associate professor of nursing, but also project manager on the HREDA project, Harm Reduction Education and Technical Assistance. Together, the Harm Reduction Coalition and HREDA have worked closely over the span of about 3 years now, covering all of New Hampshire and kind of analyzing regions for readiness, availability, and current status of many harm reduction strategies, MAT or MAR availability, that's medication assisted treatment or recovery availability, naloxone availability, all the way deep into very specific harm reduction strategies like syringe availability, drug checking, fentanyl test strips, things like that. So I'm happy to answer any questions. I've also been very, very lucky to be invited by Brandeis University, who has a drug user health department led by Dr. Tracy Green. She has helped the state of Massachusetts set up very specific drug checking sites within their harm reduction programs. These are community level, like street level programs that invite their participants to come in, receive health related services, counseling relative to HIV Hep C testing, counseling related to MAT or MAR treatment, as well as do comprehensive drug checking, which is what we're talking about today. I was able to go in and witness how those programs operate with such a, in my head up until seeing it, it was a very scientific process because we kept using the word mass spectrometer. So I couldn't really understand how it was delivered at a community level, street level. But it was really wonderful to see the flow of people coming in and engaging and utilizing this service. So I'd be happy to answer questions as they come up.
Thank you. I have one question. I know you were there briefly. Did you see the same people over and over again? Or is there any way to track, was this program actually helping them?
So I did not see them, but the chemist that was doing the testing at 2 of the sites, he greeted people, said hello to them, seemed to know them. So it seemed to be something that they utilized often. I know that one person in a Lawrence program had been coming in for about 5 years. And had been really excited when they started to have this because he wanted to be able to communicate out to his friends in his own community what was happening with the drug supply. He said he had been doing this for a long time and had not seen such an impact that the current drug supply had been making. I'm trying to keep all of the swears out of what he said. So he had seen, he had not seen such negative impact from the drug supply as he had seen in the last 5 years.
Thank you, Representative Newell.
Thank you. I just wanted to kind of make sure, emphasize a certain part of what you said. And a lot of what we're talking about is, you know, like I was just saying, the potential risks and the benefits, right? And I think that there's a lot in the benefits that isn't necessarily, that is a little more obscure, right? That kind of goes under the wayside. And one of the things that you mentioned, and one of the things that I've read a lot about when we're talking about testing centers and things like that, is the ability at that point to engage with folks, right? To build relationships with people, to build trust, which, you know, so I'll let you take it from there. I just wonder if you could focus a little bit on that, because I feel like that's something that we don't necessarily recognize as one of the potential benefits with it, and how that contributes to the overall, you know, idea of increasing people's chances of successful recovery.
Yeah. So, I mean, just a little tiny bit of history. Prior to this, I worked in direct case management with individuals with substance use disorder, primarily parenting or pregnant mothers. I had no knowledge of harm reduction, with the exception of what my public health education had taught me, so very surface level. Being in a very traditional case management setting, I had my binder full of protocol and how, you know, when somebody said this is what I did. When somebody said this is what I did. And when they tested positive for a drug in their system, I was no longer able or allowed to work with them. I had to exit them from my programming. The burnout that happens in those situations is very extreme when you feel like a positive drug test means that I no longer have tools to help that individual. So when I moved into harm reduction, I was really, really blown away by the agency that we give back to the people that we work with in all of those situations. When someone comes to me and asks for sterile syringes and a safe injection kit, the agency that is given back to them to be able to say, I am identifying to you the things that I need, and I'm able to provide them to them, a whole new level of communication is opened up between me and the person that I am serving. Because I don't have to stop the conversation. It's not a question that I need to get past with them. Are you using drugs or not? So really, it leaves all of this space and room for deeper, more authentic conversations to be happening around how to keep them safe if they are using drugs. And that's where I think you're correct, the nuances there. I will say from my own experience in the past 3 years, fentanyl test strips and xylazine test strips are utilized every single day by people who use drugs. I will tell you that the most positive population to utilize fentanyl test strips and xylazine test strips are college-age children, college-age young adults. I probably shouldn't call them children, because that is a population who has decided they're going to use a very specific drug and they are no longer interested in using any other drug that might be contaminating that one drug. For instance, cocaine is a recreational drug commonly found on college campuses. If a young adult has decided that they are going to use cocaine, they are no longer interested in utilizing that when it tests positive for fentanyl or xylazine. So that's a population where I think people are seeing the exact desired results of fentanyl test strips and xylazine test strips. That's the kind of the extreme reaction to utilizing them. But I will say in a year, we have distributed by request over 80,000 fentanyl test strips in our programming. So I hope they're being utilized because they're very expensive and people are asking quite loudly for them. So we hear from people across the age spectrum that they are utilizing the fentanyl test strips with every new batch that they are purchasing, because we don't currently have the supply available for people to use them every single time they use a drug, but with each new batch they're testing. And now we have a whole team of participants that are really engaged in not only utilizing the xylazine test strips, but in helping the companies that make them better, because there are some smaller flaws with the xylazine test strips. And so, you know, again, it's returning that agency back to a population where previously I had removed their agency many times. And seeing that engagement has really led to deeper conversations around safety.
Thank you, Representative Reed.
Thank you, Mr. Chairman. It's very promising to hear the success you're having, for sure. It seems, how would changing our current statute change your success? I mean, it seems like it's working. Why would we have to change something that's not broken?
Sure.
Thank you.
It's a great question because I look at this as like we're working with a picture of our drug supply. And when we successfully passed fentanyl and xylazine test strip legality, our picture became slightly clearer. Not clear at all. We still can't see it. It's still a major blind spot in public health, but we're starting to clear up that picture a little bit. What we would like to do from a public health perspective is be able to have a consistent and dynamic, constantly changing picture of what the current drug supply looks like, because New Hampshire is uniquely situated between some large entry corridors of substances coming in. Boston has large ports, Canadian border is not far away. And so we don't have a clear picture of what's currently happening with our drug supply in New Hampshire. Therefore, our reactions like fentanyl test strips, xylazine test strips, or naloxone are only as good as the things that we have already identified existing within our supply. My concern is that fentanyl was fentanyl was a game changer in preventing overdose deaths. That changed the game for all of us doing this work. We could have seen the need for increased or different strategies around overdose prevention if we had acknowledged or known that fentanyl had been in the supply in the quantities that it was starting to appear in, not only quantities, but in the drugs that it was starting to appear in. That was really where we kind of tripped up, was fentanyl started appearing in supply that we didn't know fentanyl was going to be in. So my concern is, what will be our next fentanyl? And we're going to have to lean very, very heavily on programs that are in Massachusetts, programs that are in Rhode Island, programs that are nearby, but are not exact replicas of what New Hampshire's drug supply looks like in the way that we approach our next xylazine or our next fentanyl. We will always be behind the times because we can only start to react to it once we know it's in the supply.
Thank you. Follow-up?
Thank you. So we already, people are allowed to use xylazine and fentanyl test strips. I heard you say you have access to a spectrometer with a chemist.
No, sorry, I don't. The programs within some of,
Yeah,
yes.
so there is testing available currently to test random samples of drugs that are on the street currently for whatever's new and novel in the drug supply.
No, not in New Hampshire. In Massachusetts. Massachusetts has comprehensive drug checking, so that's where I went
Okay,
to.
so we don't have spectrometers. Wouldn't that fall under your licensing, your health agency licensing umbrella?
No, it does not currently. So it doesn't protect my staff or myself from having these machines or being able to do this testing in partnership with our participants, the people that we serve.
And is there any, is there any communication with the state toxicology lab?
Sure.
Is our samples sent there for testing to see what's on the market, on the street? Thank you.
Sure. Yeah. So we've had a long conversation with the state public health labs. They do have some of the machinery that you would need, but to be I will give a very quick overview. These machines are called FTIR machines. FTIRs are loaded with a brain. So you can buy a brain that's relative to art. You can buy a brain that's relative to algae. We would need to purchase a brain relative to drugs and drug contaminants. So right now it doesn't have the brain that I think that the most comprehensive brain that we would need it to have. Also, receiving the samples is where the legality issue comes in. So a small, tiny amount of substance. In fact, I purchased little scoops if anybody would like to see the size that you would need to create a successful or to run a successful test. To receive those is where we're running into our legality issues. Our participants aren't able to come to us with the half a grain of rice of supply that they would need to have a test done. And currently, the methodology for how the State Public Health Lab is acquiring samples to test our drug supply is incredibly backlogged and is not coming from supply channels that would indicate current drug supply. And I can explain a little bit more if people want to know why it's not current drug supply. I'm seeing that. Okay. So, so currently right now we have a dropped powder policy in the state. So if a dropped powder is found at the scene of a crime not relating to substance or drug trafficking, dealing, then that dropped powder would be able to enter into state public health lab pool for testing, but that doesn't mean that the drop powder, like the day somebody picks it up off the ground and then enters it into the state public health lab, that's when it would be tested. They actually have a very long list of things that are going to need to go through this FTIR or mass spec machine so there's a serious backlog. Additionally, that's not indicative of what our current drug supply is because these drugs can't be utilized from any scene where known substance use was happening, an overdose occurred, anything like that. So why that powder was sitting at the scene, who it came from, why it was there, and when it had most recently been used or even purchased is completely unknown. So again, it's another picture that is very, very blurry. It is giving us some idea of what could be coming in and out of New Hampshire, what could exist or had existed, but it's not well curated data, and it's definitely not well shared data. We have a great relationship with the state public health lab, but even they know the limitations of this dropped powder.
Thank you, Representative Prue.
So why does it have to be drop powder and not something found at a scene or active?
I completely agree. I think one of the biggest missing pieces of data would be substances found at the scene of a fatal overdose. I would love to see our state enter into an agreement to begin testing that. I think that dropped powder would be the one that probably avoids. I would need, we have legal consultants here, but I would assume dropped powder probably prevents any of the evidence from being contaminated by testing or being removed from the scene specifically for testing. So because that dropped powder was not evidence, none of the crimes are related to it. I would assume it's kind of like it can just be utilized for a public health testing.
I just know, again, based on my experience, it seems like there's two different labs. There's the state health lab, and then there's the crime lab, state police crime lab. So
Yes.
they're probably not talking to each other. And there's what you're talking about. The drop powder would never go probably to the state police crime lab. It would be me as a trooper stopping a car, whatever, and I find drugs. That then goes to the state police crime lab.
Sure. Yeah, and you are correct. I actually don't have any interaction with the police crime labs, and the disbursement of information from them is not coming into the public health programs that respond to drug-related harms.
Representative Muse.
So one of the things that that actually might be helpful, I know in the beginning with the fentanyl test strips bill, it was narrowed down just to fentanyl test strips, but it was actually expanded later on so that xylazine was added. One of the things you said that's really interesting is I think a lot of folks tend to focus on harm reduction as basically being something that can benefit an individual drug user. But the fact that if you actually take all of this information and put it together, especially in a way that's more immediate than what some of the other drug testing labs can provide, it can actually provide a picture of where contaminants and bad pills, so for instance, pills that people think are oxycodone that are actually fentanyl, it can provide a picture of where are they entering, the marketplace? Are there parts of the state that are more affected than other parts of the state? What's the overall picture, in terms of the penetration of a contaminant like xylazine? So one of the things that I find interesting is we're not getting that information just by handing people out fentanyl test strips. And I think one of the things I wanted to point out to my colleagues is that, to be honest, my bill 470, the one that we're considering today, basically started out as an attempt to do what Representative Newell's bill did. My goal was just to legalize fentanyl test strips because I thought it was kind of crazy that we didn't have a tool like that was legally available for people. Fortunately, I had several conversations with Ms. McGinley and Ms. Nolte, who basically explained to me that there's an opportunity here to actually impact far more people in a positive way. And one of the things that I would say is that if we put this bill aside, if we don't do anything with it, there are some things in here, for example. One of the things that we do in the bill is we actually define drug checking in the context of our Controlled Drug Act. So we actually make it part of that. So one of the things that we actually did with Representative Newell's bill is we managed to actually legalize fentanyl test strips without saying that drug checking is necessary, is legal and is an activity that we should be pursuing from a policy perspective. So there are some I think that there are a lot of good things in this bill. There may be some ways that we can tighten it up in, in ways that I would hope would be acceptable to the law enforcement community, because I think they're just as interested as anybody in this room when it comes to minimizing, fatalities from overdoses. But I would just hate to see an opportunity to actually address part of this crisis in a meaningful way go by the boards for at least another year, while we're still in the middle of an opioid crisis. So I'm just kind of hoping that we can find a way to come together on this.
Thank you. Representative Selig, is it a question from Ms. McGinley?
Yes.
Okay.
And is it all right if I ask a series of questions that sort of they build on each other?
Yes.
Okay, thank you. Thank you so much. So my first question is, do you know about what year it was that fentanyl first was introduced into New Hampshire?
I don't. I don't because we can't test our drug supply, so
Right. but
I'm
so
unable.
if you had a guess, would you say 5 years ago, 10 years,
Oh
15
no,
years?
15, and then maybe more.
Okay, so it's
10 to 15, sure, 10 to 15. I don't know. I'm so sorry.
no, that's okay. So again, if there had been broader based ruling allowing for drug testing 10 years ago, we might have maybe been able to identify fentanyl entering our drug supply then to take action against it. Is that correct?
Yes, and if I could add really quickly, a great example of this is actually xylazine. Xylazine has been in the drug supply for an unknown period of time, but unfortunately has probably been costing hospitals and insurance entities a substantial amount of money before it was ever even identified why people were developing such terribly infected and hard to treat wounds. So that is a great example of we did not know what was happening. Even our population of people who use drugs did not know what was happening, but had been seen multiple times for severely infected wounds, which could have easily, if we had known was in the supply, been linked to xylazine, which is what xylazine causes in humans.
And so just thinking about that, so we now have the ability to test for those two specific substances
Yes.
only
Only.
within our drug supply.
Yes. Yep.
If you had to guess, and I recognize this is pure speculation,
Sure.
of a number of other substances being introduced into our narcotic supply, and I'm not suggesting we should be encouraging narcotic supply. I want to be very clear about that. But if you had to guess, how many things do you think could be in our current narcotic supply that we don't know are there because we can't test it?
Sure. So for concerning substances in the current drug supply, the two that kind of rattle around in my head as our next big contenders, one is an ongoing problem, but I think is going to increase substantially, is benzodiazepines being entered into the heroin supply. Benzodiazepines is a withdrawal that somebody can die from. So even if we have somebody entering into treatment and detoxing, not knowing that benzodiazepines might be in their system or in their drug supply for as long as a year, 2 years, 3 years, we don't know what their benzodiazepine, has exposure has been like. That to me is very concerning. Additionally, levamisole is a new contaminant that's starting to show up in Massachusetts. This is going to cause serious wounds the same way that xylazine is, but these wounds are going to create deeper abscesses into the tissue, which is going to, it's a whole bigger beast. Currently, xylazine wounds resemble and kind of react like burns, severely, like third-degree burns. These wounds are going to be much deeper into the tissue, sometimes into the muscle, some bone infections, things like that. It's not, these are not going to be wounds that are going to be able to be treated at street level with some of our own wound treatment specialists that go out to people. So those are two substances right off the bat that I would love to know the saturation in New Hampshire and what that is going to start to look like.
Thank you. I've got one last one, and then so you know, obviously it's wonderful that we can now test for the two substances, right?
Yes.
I'm just curious, as I read the original intent of this and even the potential amendments to this version, it's really about creating space so that as our knowledge of the drug supply changes, things can have a quick pivot to test for things to hopefully prevent, I mean, not just harm reduction, but also to help bring awareness to things. You know, like I think about when carfentanil, which is an elephant tranquilizer, started getting introduced on top of fentanyl into a number of things. I'm not sure what the status of carfentanil is at the moment and if that shows up in fentanyl test strips or not. I don't, it's beyond my level of knowledge. But I'm just curious if that resonates with you, that the idea would be that this would allow us a way to pivot quickly to test for things that we don't know about yet because they're not here yet.
Yes. Yeah. In public health, I think the scariest thing for you is what you don't know. I don't know what I don't know, and that unknown is what is scariest to me, because it took us a while to build strategies, mostly in part with people who use drugs, around preventing serious injury and fatalities related to xylazine. But that turnaround time from being able to acknowledge that it's in the drug supply to having some really successful strategies to limit the harms of it was not short. It wasn't what we wanted it to be. So not having blank test strips. So originally, Representative Newell's bill was for any rapid testing strip. That would have been successful for us because as we speak, about 4 different types of rapid test strips are being created for distribution to public health departments. We won't be able to utilize them because the bill was limited at some point in its lifespan here. But, we can look to our other states around us to see what they're starting to see. What we're not going to be able to see is their pathway through the state and how they're impacting different regions much more harshly than some. And then we won't be able to see what is here that isn't in Massachusetts, what's here that isn't in Rhode Island.
Thank you, Representative Reed.
Sure.
Thank you, Mr. Chair. Would this better be addressed with a policy change, a communication between the state lab and the the crime lab? Can there be like a communication between the 3 of you?
I think that would be a good step in kind of like a detour direction to putting together what we currently have and utilizing the most of that. What we would love to see, though, is a much wider pool of data. So if we're only using powders found at specific crime scenes, we're still not, the amount of people that would come in and have their substances tested, or they found these and now would like to have them tested, we would just see such a bigger pool of data, thus clearing our picture much, much more. So in the days that I went to drug testing programs, about 25 to 30 tests were done each day that I was there. And that is happening 7 days a week in Massachusetts. So their picture is becoming more and more clear with more samples.
Thank you, Representative Newell.
Ms. McGinley mentioned that she has scoops that give the amount. Would it be okay for me to hand those out, pass them around so we can see?
Yes.
Thank you.
Sure. Yeah, so 10 milligrams is a difficult, I think that was maybe what the measurement that was decided upon in a limit in the bill. Oh, sorry, you can have the whole bag. They're all for you. Because sometimes we take a 10 milligram pill every day, or we take a 20 milligram pill and we see that pill in our hand and we think that's a giant amount. But the milligrams on the medications that we take is a concentration level and not a measurement. So this measurement is the max amount that would be needed and would be necessary to do this. Earlier in this bill, when it was up for discussion, it was thought that perhaps people who deal drugs would now break their drug supply up into 10 milligram baggies. That's not the case. As you can see, that's not the case and would be impossible to do. So I just wanted to give a solid visual of what we were looking at.
Thank you, and I do appreciate this because that was my thought, that the dealers would continue to break it up into
Sure.
hundreds of thousands of little milligrams and say, look, I just have my little testing supply. So I do appreciate this.
Sure. In fact, most tests are actually done with the residue in a cooker or a cotton or a residue of a baggie that people are bringing in. Most people are not bringing in their substance, they're bringing in something with residue, and we're more than able to do a test with any of those.
Thank you. Any other questions? Thank you so much. I appreciate this.
Sure. Thank you.
So I think we've heard a great amount of testimony and some good back and forth with my fellow representatives. We might just now be going in a circle. I'd ask if anyone wishes to provide a motion at this time. Go ahead, Representative Selig.
I see that we do have other people in the room. I didn't know if any of them like have a specific thing that we, I know we heard testimony earlier in the year, but as we're doing this today, if there's someone who's maybe brought some information that we are not aware that we don't know, before we continue. And then I also wonder whether there's openness to developing an amendment at all that would allow us to move forward with something to allow for additional harm reduction measures, especially since I had to borrow Representative Newell's readers in order to see the bottom of the scoop.
It's there. Trust me, I can see it just for now. Is there anyone else that would like to speak? And Representative Selig, I would like to put this to vote, but in the interim, before we get it back to the committee, if anyone would want to develop an amendment, and this is where this extra time, I think that if I can gut it to present my own amendment, and maybe Representative Muse, take whatever we said today and tweak yours a little bit, I think that would be great. I'm definitely open for the amendments. I just don't want to see it to completely die, but as is for me, maybe others up here, that I can't go with this right now. Is there anyone else that wishes to speak? Sir, if you could just state your name when you come up.
My name is Jason Blackburn. I don't have any new information to add. The woman that spoke before me is very highly knowledgeable. I just have a little bit of a personal statement that I wanted to make. My name is Jason Blackburn. Well, excuse me, let me back up. Honorable representatives of the state of New Hampshire. My name is Jason Blackburn, and I am a person in long-term recovery. I currently work in behavioral health on the front lines of substance use and psychiatric challenges. I've been in recovery from substance use for 15 years. In that time, I have lost count at the number of people I have cared about that have lost their lives from overdose. Halloween night 2013, I came home to find my best friend and roommate Eden overdosed in the bathroom. I performed chest compressions on him until EMS arrived. They did all they could. This Halloween will mark the 10th year he has been gone. I firmly believe that fentanyl played a part in his death. The current state of the drug supply in this whole country is toxic. Having the ability to test drugs can save a life. Items such as fentanyl and xylazine test strips are harm reduction tools, not drug paraphernalia, just as much as naloxone and sterile syringes are. All harm reduction tools are necessary components of battling the ongoing overdose epidemic. Why? Very simply put, no one can attempt to begin to embrace substance use recovery if they are dead. Naloxone saves lives, sterile syringes save lives, fentanyl and xylazine test strips save lives. Thank you for allowing me the time to speak today.
Thank you so much. There's been a request for a caucus, so a brief 5-minute recess. We will now be reopening the Criminal Justice Subcommittee work session on House Bill 470. And Representative Reed for a motion.
Thank you, Mr. Chairman. I vote to ITL the bill.
I'll second the motion.
Seconded by Representative Prue. Representative Reed, do you wish to speak upon your motion?
I do. This was a very hard decision to come to because the public safety aspect of testing is critical and very, paramount. I, struggle with all the, nebulous areas of the bill and the amendment that allows, a lot of, potential abuse. So, that is the only reason I suggest ITL.
Representative Prue?
I'm in the same predicament, right? So I think there's a lot of good to testing and we need to make that work. But we also, in this, need to close the back doors. And I'm hoping between my colleagues and you guys over there that we can get a better amendment to close some of those things, especially like on this last page. So, and then I'm all for this, right? And I think one of the things I would really like to find out is in Massachusetts, in Rhode Island, I believe is where it's happening. Do they have a back door that's being abused, or did they find a way to close it? So I would like to look at that and maybe put that in our amendment if it's working down there and how they get it to work down there without this. And I was really glad that you brought me that spoon to really visualize, you know, I know what it is, but to see it in that little amount and tell me that, yeah, sometimes we just use the residue from a bag that they have, was very helpful to get my head around this. So, because, you know, I would really like to pass it and say, well, if the back door gets abused, we could close it later, but I know that never happens. Never happens. Or it's very hard to get that to happen because once it's gone through, it just, nobody wants to look at it again and try and fix it. So I think we need to fix it right here, right now, before it goes to our full committee for a vote, and then we can look at it there.
Thank you. I agree with everything my colleagues on this side said. We want this to work. We probably will have a couple weeks for this to get back to committee. In the meantime, maybe you guys do a further amendment. We'll figure something out. We do want this to work. We really do. But we just don't want to close the back door, and we want to help people survive and live. We don't want to see anyone perish because of this disease. Representative Selig.
Thank you so much. I think I'm confused procedurally, because you're talking about making an ITL recommendation, which would kill the bill, and making an amendment. And if it's ITL, there's no point to an amendment. And so my understanding of the process, and again, I'm new, and so perhaps one of our more experienced members can clarify the process. But my understanding is the purpose of us having the subcommittee is so that we can hash out the details so that we would provide a joint amendment that would be from all of us or the majority of us to address this rather than voting. Because if we end up with a 3-3 tie, we have no recommendation. But then if we're coming with different amendments, I'm having a hard time seeing these nefarious back doors. It feels to me like being afraid of the boogeyman rather than having, and again, that's how I'm just hearing it, and I'm not suggesting that's where we're going. I recognize that there's concerns about drug dealers using things. I think there's easy ways to address that, although I'd also rather if drug dealers weren't delivering these dangerous substances, and if that's the issue, then we just figured that out. But I just procedurally, I'm very confused by the motion to ITL and then the talk of amending.
Thank you. The boogeyman is real, and they do show up, and I've been there and I've seen the boogeyman. I would like to, as the chair, think of how it is procedurally, and I'll definitely refer to Representative Muse after. My belief is this is a recommendation to the committee. It will be brought to the committee. The committee can then hear further amendments in that committee. we would then vote on it. It would then either go to the House, maybe without a recommendation. We could even still amend it before we vote on it in the House. That is my understanding of it, and definitely Representative Muse, correct me if I'm wrong. It happens a lot.
Oh, and that's okay. It's taken me 3 terms to actually catch on to some of this my stuff myself. But as a subcommittee, we have several different ways we can go. One is we can make no recommendation at all. Then what happens is the bill goes back to the full committee and people just vote wherever the chips may lie. We can recommend ITL. And if ITL is the recommendation of the majority of the committee, then the committee would vote. The full committee would vote on the ITL recommendation. But because it's an ITL recommendation, no amendment would be possible in committee. What would be possible would be a floor amendment if we kind of fought it on the floor. So if we had an ITL recommendation. One of the options for us would be to oppose the ITL recommendation on the floor and also to include a floor amendment, which realistically I don't think is the way we want to do this thing. I think what we'd rather do is to try to come together on some kind of an amendment. So the other thing that we can do is we can work together on an amendment. We can vote on an amendment. One of the things that we can do is to kind of get there is sort of what I tried to do today, which was to take the previous amendment and sort of show you in a marked up MS Word version what it kind of looks like in the original bill. And then what we would do, once we kind of agree on the parameters of an amendment, is we would go back to legislative services, and legislative services would actually create a formal amendment that we would vote on in a subcommittee. So what we would do if we created an amendment would be our recommendation back to the full committee would be ought to pass with amendment. And then the full committee would vote on that. And as always, we vote on them separately. So the committee would first have to pass the amendment, and then we'd have to pass the bill as amendment. And an option for the full committee, and I'm not 100% sure if this is an option for us from a recommendation perspective, but one of the things that you can do with a bill in the second year is to recommend it go to interim study. And so realistically, interim study can be sort of a nicer way to kill a bill. But I think one of the things, to note is that we've actually had some success in our committee of actually remanding a bill to interim study, discussing it, and then recommending it for future legislation. The problem with interim study is, when you're in a situation where there's a crisis and we're looking to do things to make things better, all we can really do at the end of that is make a recommendation for a future legislature to pass a bill like this. We're not actually passing the legislation ourselves. So essentially what it means is a year delay in doing something. So what I would say, if there's willingness to work together on an amendment, so we can move this thing forward, I would love to do that.
Thank you, Representative Reed.
I agree. But I would want to go line by line together, okay? And then once we agree line by line, that's the amendment we present to OLS, or legal services.
And that's right. And I mean, based on experience with this, I think that when there's goodwill on the side of, both parties, we can actually go through a process like that to do it. And it also gives us the opportunity to kind of go through things that, like the rationale for some things, being X'd out of the original bill and other things appearing. And I think in large part, what we're trying to do with this bill isn't necessarily to, create, big drug checking centers, like they have in some states. But I think what we're trying to do is we're trying to get drug checking into the Controlled Drug Act. We're trying to eliminate a situation where public health professionals can actually be charged with a crime, for helping with drug checking and things like that, which is a possibility now. And most important of all, we're trying to make a dent in these overdose fatalities.
understood, but I mean, look at Oregon, you know, Washington, Philadelphia, New York. They're all colossal failures. We have to be able to do better, all around. And, you know, and I think that we need to look at this and protect the person on the street, but not have that happen. We don't want to deal with Oregon, Washington, New York, Philadelphia, San Francisco. We don't want that for New Hampshire.
So
I'm
this is, if I
pretty
could just
comfortable.
interrupt. We're definitely in agreement. We're going to work together because it seems like both of us are all having like the testimony again. My concern was that we'd run out of time. Do you know the time restraints that we have to get this back to committee? I know it was November. Does anyone know the time limits when we have to get this back? Brad, do you know? November. So we have time.
So that would be Brad, the full committee recommendation is due by the 17th of November?
Yep. Thank you so much. So I guess what we'll do is that gives us time. I was confused. I thought we had to get this right out and then we would ITL it and then try to throw in our motions, our amendments. But Representative Muse, thank you for filling us in. Everyone is in agreement that we're going to meet up down the road. I know we don't want to keep coming back, but this is something where all of us really want to make this happen. Representative Selig.
So would you be open to withdrawing the ITL?
I'm going to withdraw my
Okay.
second
yes.
right now.
Sorry, I just,
We're slowly getting it to where we all know it. Would Representative Reed like to rescind her motion?
Yes, I will rescind my ITL.
Representative Prue, your second.
I withdrew it.
Withdrawn. Okay. So, go ahead.
so I'm wondering whether we even right now can start working through some of the language, or if you want to have a sub whatever, whatever number it is. Sorry, my words are a little messy. But to work out like whether there's a way we can bang the language around back and forth to get this to an acceptable place and then meet again next, like give ourselves till next week maybe to work on language that we can all try to work to agree to and then create an amendment or something.
For my scheduling purposes, I will not unfortunately be able to do that today, but if we can plan all of us together to plan maybe a 5-hour day, not saying we will, but we can all put it together, bang heads, and then we can work it out, and then we'll get our vote, hopefully all 6-0 OTP. Representative Muse?
What I would suggest is that we all go through the marked up version that I included today. If there are, I can send that to people electronically as well, and I'll do that just so you all have copies of it. What I would suggest is if there are areas in there that are problematic for you, circle them and then just jot down really quickly why it's problematic for you. As we're going through the bill, one of the things that we can do is we can talk about those areas. But I think one of the things that's important from a process standpoint is not necessarily letting an early bump in the road keep us from having a robust discussion about the entire bill. So if there's something that it looks like we're not agreeing on, one of the things that I find with legislation is that sometimes if you just keep talking and you start to address other issues, some kind of a solution to the earlier impasse can sometimes make itself available. And so what I would suggest that we do is rather than letting anything like that become an impediment to us doing anything, we just put it in a parking lot and we move on to the next thing. And then at the end, we revisit the things that we need to revisit and try to come to agreement on those as well. But to me, that seems like a good process for for getting to a better place.
Just a
an
reminder
amendment.
that we can't be legislating in private, right?
That's right.
Why we have to have open meetings. So we can I'm thinking, like, my view is, I don't like this, and we can decide to create an amendment with that, whoever's writing it. But then we need to really discuss why this and that here, right? So I can look at this and say, I want this out and that for an amendment. But I think that's as far as we can go.
One of the things that I believe we do have the ability to do would be to caucus on
Right,
things.
so you guys can caucus and we can caucus.
Yes. And so,
We
and
can't
so
caucus together.
that's right. Or not, and I can't, I can't, meet Jeff at Dunkin' Donuts and work it out there. I mean, we can't do that stuff.
We'll
So
just have
everything,
it on camera and they can view us.
yeah. But one of the things that we can do, or my understanding is that we can develop caucus proposals, and something like that may actually help, because sometimes I find that even working among my fellow Dems, just sort of being able to address points that we're not quite understanding the same way can be really helpful, just to kind of getting us all on the same page. So I think that's something that could be done. It's not essential, and what it would not do is preclude any member of the committee from basically saying whatever they want, or expressing the fact that they may not agree with a particular change everybody else is set with. And but it is important that this is a public meeting, and we are supposed to be doing this out in the open as much as possible, and I think we need to respect that.
So, Representative Selig?
I just was gonna say, in terms of meeting next week, I could do Tuesday, Wednesday, or Thursday. Schedule wise, I can't do Monday or Friday, but I can do any of the three in between.
Halloween first, second.
That's correct. I just,
Yeah.
I have things on the bracket days I absolutely can't do.
Wednesday, definitely not. I have small children and I have to be the candy man.
Oh, you mean Tuesday's Halloween?
So for my town, Pelham, we do it always on Halloween. I know some towns do it like on the weekends or whatever. And I do plan on us being here for at least a couple hours to really bang this out and, see what we're going to put together. And then we can go to OLS, get that amendment, and hopefully we vote it out as an OTP 6-0.
So we're looking at the first?
We can do Wednesday the 1st, probably another 10 a.m.
Sure.
Sound good?
Yeah.
Okay, so we will eventually move this to Wednesday, November 1st at 10 a.m. And yep. Yes.
Just you've made reference to a number of things that you guys specifically want to make sure gets changed out of here. Would you be willing to just give me a sample of one line? It doesn't have to be many, of one thing you'd like changed, just so that I can have a greater understanding, other than like the broad idea, but just so that I can help work on preparing for next week.
Page 2, starting line 16 of the original bill, all the striking out wordage of processing, preparing, the included. I basically eliminated the entire, in my head, the
Wait, I'm sorry.
so on the original bill, not the amendments.
Yes.
So page 2, line 16, XA, drug
Oh,
paraphernalia.
okay. Yes. Sorry.
This was me, and this is not their thoughts. They have their own, but I wanted to delete all of that because that is in essence changing the definition of 318B1, which is drug paraphernalia, and this is where I started to have in my mind the back door for the dealers to be able to use this. I had thought about maybe eliminating that and then putting it in with maybe even the fentanyl bill that just passed, fentanyl strips that, except for, and again, I don't know the verbiage off the top of my head, but that's where I was looking for, to maybe put it in with that so that this 318B1 would not penalize the person who wishes to use the test materials, but it would still punish the nefarious characters.
Okay.
And we can go Representative Reed or Representative Prue.
Thank you. No, that helps. Thank you.
I have an issue with the very last page, Roman numeral 5, with all of that included.
In the amendment.
In the amendment, this one right here. I don't know if Muse gave you that. Yeah, there you go, last page. It said, Roman numeral 5. There's just, a lot in there that I think, would end up hurting the person, the substance abuser and helping, the nefarious characters, and I will refine that for our next meeting. And all the words included in the drug paraphernalia, but primarily that caught my eye. Your turn.
I'm good for now.
Does that somewhat help?
Sorry. Yes, thank you so much. For me, talking up here makes it really hard, and it's helpful to me to have some concrete steps to look at.
Yeah, I was in the same boat. I'm looking at it, putting it down, walking away, coming back. Like I was like a madman with this bill. Like I want this to work, but then I'm towing like, which way do I go? I don't want the bad guys coming in, but I want people to live. So that's where in my head I was really like circling, but let's make this work. One last quick.
I just want to thank you again. I know that at the beginning of our conversation today, there was a sort of set, we're going to end with this result. And I appreciate that we've shifted from that to having a conversation, to looking at how we can have true bipartisanship for the greater good of New Hampshire rather than for any one individual. So thank you.
Absolutely. And I will hereby close this subcommittee work session on House Bill 470.